I'm Dr. Denise Rollette, and I'm going to demonstrate a pediatric chiropractic adjustment. This is my grandson, Trace. Trace is visiting, so we thought we would use him as a great example. So first thing, before we do any kind of adjusting technique on children, infants, we have taken a thorough case history. I was with him when he was born, so I know of all the birth challenges that he had in being born. Then what's often run is a surface EMG or a thermal scan to evaluate how his nervous system is doing. From then, we have an infant table that is set for them. If they're not being cooperative, we also put them on the mom's stomach face down. But what happens is we bring a baby. I usually have some sort of a blanket, and he or she will lay face down on their stomach. Yes. It's extremely gentle when we adjust the baby. We come and evaluate the tailbone area first to see how the bottom bone, called the sacrum, is doing. We then check how to see if the hips are moving properly, and they enjoy this. It's not an uncomfortable position at all. Then we start with the lower back. Oftentimes when infants have a subluxation or a misalignment in the lower back, it will affect their bowel system to where they just don't eliminate like they're supposed to. Trace has no problem with that. He's been adjusted since he was born. And then we just travel up the spine. He's being very cooperative today. Oftentimes if there's a misalignment in the mid-back, oftentimes that will cause an infant to have quite a bit of colic, sometimes reflux, and we see great changes with that with an infant under chiropractic care. Today Trace has a little bit going on in his middle back. He's been traveling on a flight, on an airplane, and so we'll just very lightly hold just a bit of pressure to that area, just like that. Very good, and then we check the upper neck area. When he was born, there was quite a bit of rotation and of course coming through that birth canal. And so he has sometimes a little bit of challenges right up at the very neck. So then we'll gently turn him over. You can lay right on your back, there we go. Cover him up a little bit. And then when we check the neck area, we'll rotate him just a little bit. And it's a very gentle holding pressure like that. And oftentimes we'll come to the upper neck and the sacrum area, and then we'll just do a gentle little traction. Very, very gentle. It's almost a fingertip pressure. And as you can see, he's very happy. It's not painful at all to him. And like I said, if they get frantic at all, we'll usually lay them right on top of the mom or the dad. There we go. There we go. And that's it. And then we bring them up. Give them a little hug, and then they're done. And that's pretty much what's typically done when they get a chiropractic adjustment. Doesn't look like we do very much, but it's extremely effective. So.